If you have little to no arm movement after a neurologic injury and you are struggling with your recovery, mirror therapy could be the missing link to unlock a whole new level of arm movement, potentially. And in today's video, we're going to go through the evidence to see if mirror therapy might be a good solution for you. If you're new to this channel, I'm Tara. I'm a neurologic physical therapist with 22 years of experience helping people restore their mobility and their independence after a neurologic injury. And I've taken everything I've learned in those 22 years and put it into a toolkit, giving all of you 24/7 access to all the tools I think are essential to restoring movement after a neurologic injury. And that's all part of our Rehab HQ membership program. To learn more about our membership program and to sign up, you can visit rehab-hq.com. But now back to today's video. In today's video, you're going to learn a few interesting facts on how the brain turns a thought into an actual voluntary coordinated movement, what happens after a stroke that has caused you to lose the ability to move your arm, what mirror therapy actually is, and what is the impact that that has on the brain after a neurologic injury. And we're going to end this video with some exciting literature that goes into some potential ways that we can use newer technology to really magnify what we already know are the benefits of mirror therapy. In other words, take the same mechanisms that we know work from mirror therapy and use newer technology to really amplify the effectiveness. As usual, before I dive into the evidence, just to make it make a little bit more sense and to help you to make the decision as to whether or not mirror therapy is right for you, I want to talk a little bit about what happens after a stroke. As many of you know, if you've been around here for a while, when you have a stroke, an artery either has a blood clot or it ruptures and blood flow is cut off from a specific region or a certain region of the brain. When blood flow is cut off, you lose oxygen. When you lose oxygen, neurons lose the ability to function and they die. Extremely simplified, but that is the foundation that is critical to understand prior to deciding what exercises are best for you after a stroke. Most strokes, about 80% of strokes, involve the middle cerebral artery. The middle cerebral artery supplies blood, oxygen, and nutrients to the primary motor cortex. The primary motor cortex is a strip on the outside of the brain that, simplified, kind of initiates the cascade of events or cascade of neural communications that occurs in order to execute a voluntary movement. But it usually doesn't just impact the cortex or that motor strip on the outside of the brain. Many times it also impacts the little wires that take that signal from the motor cortex to the spinal cord, called the corticospinal tracts. Now stay with me because this is important to be able to visualize this to know whether or not mirror therapy is right for you. So if you have damage to the motor strip, the motor cortex, or you have damage to the cortical spinal tracts, the little tails or wires that take that signal to the spinal cord, you will have some very specific impairments, including weakness or the feeling or sensation of a dead arm, meaning when you try and move the arm, you know what to do and you know you're sending the same signal that you used to send before your stroke, but nothing's happening. That's called hemiparesis. You can also end up with what we call abnormal synergy patterns. Abnormal synergy patterns, many scientists believe that these are just ingrained primitive patterns that can re-emerge after damage to a motor area of the brain. Basically, very simplified, when you look at babies before their brains start to develop, they are using primarily synergy patterns. They're either all flexion or all extension. Some scientists believe that when the brain is damaged as an adult, you revert back to kind of these default codes that are ingrained in the brain. Those are abnormal synergy patterns. Some believe, in the scientific community that synergy patterns are one stage in the recovery process, just like you see an infant using these synergy patterns when before they learn how to crawl to just kind of move around on the floor. They use them to roll, they extend and they roll onto their back, or they flex up and they roll onto their stomach. Some scientists believe that you kind of go through this same developmental stage when you're recovering from damage to a neurologic injury, or redevelopment stage after a neurologic injury. What else happens if you have damage to this motor strip or to these cortical spinal tracts is you can end up with spasticity. Now, there's a lot of different theories on what causes spasticity. The one that makes the most sense to me is as our brains develop. So visualize that infant again as they're getting into the stage where they can start crawling, meaning they can move one arm independent of the other arm. They're no longer all extension or all flexion. The theory is that the brain learns how to inhibit movement. So instead of all the joints kind of firing at the same time with these kind of ballistic movements, the more developed brain is actually learning how to suppress certain muscles at specific times so that we can execute more coordinated movements, meaning one arm can extend while the other arm flexes, as I had already said. So after a neurologic injury, I've talked about this quite a bit. Spasticity is a sign that there is damage to the brain or the spinal cord. And the easiest explanation that I can think of is that the teacher has left the room and now the muscles are just left to go to town. So you don't have that higher level input. And so you get these very kind of just ballistic, involuntary muscle contractions. That's extremely simplified, but for those of you that have spasticity, hopefully that will help you to understand kind of what's going on in the brain and the spinal cord and in the muscles when your muscles do these weird, strange, involuntary contractions. Right next to that motor strip is a sensory strip. So we call that the primary sensory cortex. It sits very close to the motor strip, and what the sensory strip does is it takes in all the information that's coming from the body. Now, you can see why these two need to sit very close together and how they are both critical in executing coordinated movements. For example, you're moving your arm towards an object, your brain needs to quickly kind of pay attention or get information to the brain about where that arm is in space so that you can modify that movement to make sure that you are as precise as possible in reaching that arm for whatever object that you're trying to reach for. That's the job of the sensory part of brain, that sensory strip communicating with the motor strip, and is necessary for coordinated movement. So after a stroke, you can also have damage to the sensory area of the brain, and the symptoms that will emerge with that are usually loss of sensation, meaning you no longer are getting that input that's giving your brain and the motor cortex information about where that limb is in space. So you might feel uncoordinated. At times, you might not know where the arm is. Sometimes therapists will check this by having you close your eyes and kind of verbalize where you think the arm is without using your eyes. And after a stroke, not knowing where that limb is in space with your eyes closed can result from a stroke. And then a close cousin symptom that isn't necessarily due to a damaged neuron, but something that does occur after a stroke and that I've talked about on this channel is learned non-use. That is kind of the behavioral response that occurs after a neurologic injury. When you wake up, you go to use your arm like you've always used it. It doesn't move. That creates kind of a negative feedback loop that causes you to be less likely to use that arm with future activities, which can also look like hemiparesis, but it's important to know that this is a behavioral response, not necessarily damage to a neural network. And that's really important as we get into mirror therapy. Zooming way back out, and if all of that was Greek to you, none of that made sense, the biggest thing I want you to get or take away from this little segment that we did on what happens after a stroke is that you are unable to move your arm, for the most part, simplified, generally speaking, because you've had damage to a wiring network, a neural network on the hard drive. Not necessarily because you have a weak muscle or even you have damage to a nerve that takes that signal from the brain to the muscle. None of that's damaged. You have lost a code that through experiences as an infant and a toddler, you developed over time to decrease the cognitive burden as we develop through childhood so that you can think about something else and walk at the same time, right? If we have these kind of codes built into our brain, it just means we can do things more automatically and not really have to focus on them and kind of be able to like dual task or multitask. So these codes are really critical, and a stroke can wipe out some of these codes that you've built and developed through those developmental stages or those developmental years. And then there's one more kind of interesting concept I want to go through on how the brain works in healthy individuals, because it really will help you to understand what is occurring when you are doing skills in front of a mirror, i.e. via mirror therapy. And we'll get into what that is in a minute here. But what is actually going on? And to understand that, it's really important to talk about something that's pretty interesting in how our brain executes movement. So we have two hemispheres in the brain, and both hemispheres have this motor strip and this sensory strip. The right strip on the right hemisphere communicates or is responsible for the left hand. Most of you know this. That left motor strip on the left hemisphere is responsible for movement in the right hand. But they don't work independently of each other. They actually are in constant communication with each other. So there's somewhat of this kind of crosstalk that's going on between, and that's probably not the correct word because that word means something else that involves the neurologic system. But there is this communication that's going on between the right and the left hemisphere, those motor strips and that sensory strip. And this communication creates what we call a reciprocal inhibition, meaning that when one side or one arm, to kind of hopefully not to be too confusing, is really active, there's usually a little bit of communication that gets sent over to the other hemisphere to inhibit that hemisphere and vice versa. So there's this balancing act that goes on between the two hemispheres that is constantly occurring when you're trying to execute a voluntary movement. One example that is used quite commonly in the literature is if you are trying to open a door and you're carrying a cup in the other hand. Well, that balancing act needs to be really precise, and there needs to be a lot of communication between the two hemispheres to inhibit one hand's fine motor control, because you need a little bit more gross movement to open the door. So you've got two hands that are doing two different activities. That's just one example, but that's why we have this ability for the two hemispheres to communicate with each other. And that's what's really the linchpin that becomes a huge problem after a neurologic injury that causes damage to one hemisphere. You have damage to one hemisphere, and now you have lost that balance. You have the uninjured hemisphere that gets really, really loud, and you've got no counterbalance from the damaged hemisphere, and it just kind of, the volume gets very, very soft on that side. So picture a teeter-totter, two kids that are even weight, and now one kid has left the building. You have an imbalance. That one kid that's still left has kind of got his foot on the gas, and there's no counterbalance on the other side to kind of put that braking system in place. Probably not the best example now that I think about it. Tug of war is probably a better example of if you've got the same number of kids on both sides of that rope, and now half the kids leave one team, you have lost that balance and everything kind of drifts to one side. Okay, so now back to stroke, you get the uninjured side of the brain that becomes very, very active, and it makes it very, very hard for that weaker team in that tug of war game to even get back in the game because they just don't have enough resources. Imbalance, hyperactivity on the uninjured side, hypoactivity on the injured side. So, one of the goals of most physical therapy interventions is to get that balance back, inhibit or suppress the uninjured side of the brain so that we can give the injured side of the brain a chance to come back online. Constraint-induced movement therapy are one of the therapies that is quite popular in the neuro rehab world to get this balance back. And what constraint-induced movement therapy is you constrain the uninvolved arm, the strong arm, the arm not impacted by the stroke, and that kind of turns the volume down a little bit on the uninjured side of the brain, and it gives a little bit of a chance for that injured side of the brain to kind of get back in the game. You're kind of evening that tug of war game by immobilizing that arm. You're kind of putting weights on the kids on that one side of the tug of war, to somewhat accurate analogy, but maybe not quite accurate analogy, to allow the weaker team or the team that has fewer members now to be able to have a chance in getting that balance back, if we're continuing with that tug of war analogy. Okay, so CIMT, constraint-induced movement therapy, is just one example to help you understand kind of what the goal is in therapy and how we try and rebalance the brain after a neurologic injury that affects one hemisphere of the brain. We have a ton of also like what they consider like neuromodulation therapies or interventions. Vibration would be one of those, kind of waking up, kind of trying to get that injured side of the brain more online and turn the volume up so that it at least has a fighting chance with this very loud uninjured side of the brain. E-stim is another one. Movement retraining with robotic devices could be another one. A therapist doing active assisted movement with someone could be another one. All of those are attempts to kind of get the injured side of the brain back online. And then one that I've talked about in a couple of videos when I've looked at other papers recently is mental imagery. So visualizing yourself doing a movement with the involved arm or the involved leg can absolutely turn the volume up a little bit on that injured motor area of the brain. Very, very important. Now, those first two I mentioned, constraint-induced movement therapy and that neuromodulation, the downside of many of those interventions, and this is just based on my personal experience, is someone that has little to no movement. It's really hard to get someone from little to no movement to a place where they're showing little bits of movement with things like constraint-induced movement therapy, vibration, e-stim. Once someone has a little bit of movement, the world really does open up as far as interventions. We can kind of keep just doing repetitions and making those signals a little bit tighter and a little bit stronger each time just by doing repetitions. But when someone has no movement, our resources or our therapy interventions become quite limited. The other big downside to these interventions is they do require a lot more time. So active assisted movements, e-stim, and getting the right kind of combination of therapies during therapy time is typically just not enough time, meaning the 2 or 3 days a week that you go to therapy. So there are a lot of limitations with the tools that we have in our tool bag as physical therapists. And that's where mirror therapy comes in. So what is mirror therapy? Mirror therapy is just where you put a mirror in midline so that it's facing the uninvolved arm and you have someone do movements. And then what the person does, the patient, is they look in the mirror and they see the reflection of their uninjured arm doing these movements in the mirror. So now we've brought in another component into voluntary movement that I think is absolutely fascinating, and that's vision. So I mentioned mental imagery earlier. So we do know there's enough compelling evidence that mental imagery does help to kind of create neural networks, motor neural networks, or improve voluntary movement. Athletes use it all the time. So we know that something within like the kind of the visual system in the brain could benefit voluntary movement. So, how exactly does this work? Well, when you look at something, you get images that flash onto the back of the brain. And these images send a signal to another area of the brain that is kind of like a motion detector in the brain. So, image flashes onto the visual cortex. That sends a signal to kind of the motion detector in the brain. The motion detector in the brain kind of increases the focus on wherever that object is or where that motion is occurring. Now, the way that I visualize this, or what might make sense to most of you, or how it makes sense to me, is when you see babies and they will kind of almost surprise themselves, they'll see their arm kind of flopping out in the on the side of them a little bit, and you'll see that take their attention. That to me is a visual of what's happening when an image flashes onto the back of the brain, and then this motion detecting area of the brain is then receiving a signal. Imagine that baby that they just kind of surprise themselves. They see their little toe or their leg flail in front of them, and immediately their attention diverts to where that motion is coming from. Now, from there, it's also very interesting. Once you get this motion detecting area of the brain, just like a motion detector that you have on the outside of your house, now it goes into kind of data collection mode. So, data collection mode is, what is this object? Okay, this is my hand. This hand is attached to to an elbow. That elbow is attached to a shoulder. And what this next area of the brain is doing is it's kind of mapping that all out. It's taking in all of this data just like a security camera would, and it's storing it so that it can remember, oh, okay, this is an arm over here. This is how it moves. This is how the hand moves. It's attached. And it kind of is giving all of this information. Now, the purpose of collecting all of that data is to create kind of a map in the brain. And what this map does is it helps you to be more efficient in the future. So now that you're collecting all of these data points, you can be much more predictive with things. So you're walking up to a curb, images onto the back of the brain, motion detector comes on, starts collecting data. The first time you do it, you approach it, you lift your leg, you step up onto it, you execute that safely, effectively, and you are able to continue walking. When the next time you see an image of a curb flash onto the back of the brain, now you have a little bit of a map already mapped out, so you don't have to think as much or as hard. So that's the purpose of this kind of visual system interacting with the motor system to make movement more efficient, i.e., automatic, less thinking, more predicting, and executing based on those predictions. And now that you understand that, that brings us to probably the most important mechanism that's occurring with mirror therapy. You're putting that mirror in midline, you're getting the reflection of that hand, you're getting an image kind of by trickery. You're looking in the mirror of your involved hand, you're stimulating that motion detecting system that now starts to create a map. And then this mapping that's going on is really what the motor cortex and the sensory cortex kind of tap into when executing a voluntary movement. They're all very, very closely connected, but I just cannot stress enough the importance of this visual system on voluntary movement. And to kind of further that, just based on all of our experiences living and moving in the world, is when you say something like, that's so easy, I can do it with my eyes closed. That means you've developed a pretty good motor map that you no longer need any visual information whatsoever. You already kind of have it downloaded on your hard drive. That would be another example of how the visual system and the motor system work really well together. And when the motor system is removed, if you don't have this map, why sometimes your movements fall apart. Now, when I say when the visual system is removed, that means standing in the shower and closing your eyes when you go to rinse your hair, or putting a shirt on where you're pulling the shirt over your head and you can't see your arms, things like that. Some of you will relate to that. if you've had a stroke, because these are where you can kind of get into a pickle, and that's because you don't have that motor map. But that's not really part of this video, but just to help you understand this importance of vision and the motor system working together. But remember, I also mentioned that sensory strip in the brain that sits very close to the motor strip and how integral that is in executing coordinated movement. This visual information shoots over to that part of the brain as well. Because remember, that part of the brain is taking in all kinds of information about where the body is in space. And so when you use a mirror and you're seeing a reflection that your brain thinks is your involved arm, you're also stimulating that sensory area on the damaged side of the brain. And they know this because of the brief literature review that I did and the meta-analysis I looked at that was looking at mirror therapy. They've taken images of the brain when someone's doing mirror therapy, and they know that these areas of the brain kind of light up or become more active. So that is another benefit of the brain, as you're stimulating this sensory area of the brain, again, on the damaged side that sits very close to that motor strip in the brain and is in constant communication with that motor area. But what's also happening is, remember that balance that I talked about? Well, when you are looking at a reflection of your hand in the mirror and you're getting that kind of stimulation of that sensory area on the damaged side of the brain, and that's maybe sending some signals to that motor area, what you're also doing is that activity on that side of the brain is helping to inhibit the other side. Remember that communication, that cross communication between the two hemispheres? That stimulation will dampen the very loud, uninjured side of the brain. So now imagine that we're going back to that tug of war game, and not only are you putting weights on the team that has more people on it, but now you're also combining that by putting a few more people back onto the damaged side or the smaller team, the team that has been less active and was losing the game. You're getting them into the game, you're bringing that balance back between the two hemispheres. And then this taps into something, a new term that I learned while preparing for this video called Hebbian plasticity. And Hebbian plasticity is when you get neural networks firing together, they actually wire together. And over time, by doing this repetitively, you send a signal to move the arm, you see the arm move, it creates kind of like a positive feedback loop. You are now strengthening that neural circuit. And this can be both a good thing and a bad thing. Now, remember what I said at the beginning. Mirror therapy is really, really good for those of you that have little to no arm movement. But little to no arm movement and just kind of watching your uninvolved arm in the mirror, based on what people tell me, it's a little bit like not motivating. Like, you know, you're tricking the brain, you know, your arm isn't actually moving. And that can make it challenging to kind of tap into this Hebbian plasticity. You really kind of have to buy into this idea that your hand, that the hand you see in the mirror is your involved hand. And there's a couple of other downsides to mirror therapy that I think are very important to mention. It's not for everyone. It takes a lot of attention and a lot of focus. You can't just be like looking in the mirror and also like thinking about, you know, what your therapist had for breakfast, or, you know, how your wheelchair is at a slightly wrong angle over in the corner of the gym as your therapist is trying to do for something with you. Very real examples. Or, you know, how did your therapist drive to work today? And the only reason I know this is because all of a sudden, out of nowhere, someone will ask me kind of a question like this while we're trying to do therapy, and then that cues me in that they've lost attention to the activity. So that is a downside of mirror therapy and why it might not be beneficial for many people out there. In my experience, this is just my opinion, the data is kind of mixed on this, but right-sided brain injuries usually have more difficulty attending to an activity. They usually have more spatial awareness deficits, which would be good, mirror therapy would be perfect for, but because of these attention areas kind of being impaired as well, it can make the effectiveness of mirror therapy dramatically diminished in my experience. Some other limitations of mirror therapy is it's pretty unnatural. So turning your head and looking into a mirror that is, like 5 inches by 7 inches or 8 inches right next to you isn't natural. And there's a piece of you that kind of knows that that's not natural. So that's another kind of limitation of a mirror. And then also because it is just this tiny mirror off to the side, you're limited on what you can actually do. So yes, you can do some finger manipulation things. You can manipulate small objects, any big object, and you're going to lose it. It's not going to be in frame anymore and you're not going to see it. So that's another limitation of mirror therapy. And then also most of the literature, they're testing it where people are doing it 5+ days a week, 5 to 7 days a week, which for many people is just not realistic, mainly because of everything that I just said, is you can lose motivation quite quickly using mirror therapy. And interesting, one other paper I read, but I didn't use it as like the foundation of this video, but there was one study that interestingly found that people that did it for 4 weeks had better outcomes than people that had done it for longer than that. And I think you start to maybe adapt, or you start to like there's like a negative feedback loop that probably develops at some point, or maybe it's just a motivation factor. But I do think that's like really important information to not gloss over. And at some point, maybe I'll look into that one paper a little bit deeper, or the couple of studies a little bit deeper that showed that 4 weeks was better than like 8 weeks and 9 weeks, or was, when compared to other studies, was better than the longer studies. The outcomes were better. So there's probably multiple factors as to why that is. And again, most studies looking at stroke, there's a lot of heterogeneity, meaning that the participants that enter these studies are very diverse. There's a lot of limitations with any study that is looking at people that have had a stroke. So always keep that in mind. If a therapist is giving you an intervention or is doing a therapy with you and they say the evidence says that this definitely works for someone who's had a stroke, I would take their opinion with a grain of salt, because I'm not certain about anything based on any stroke, the study that I've ever read. So anyone who is speaking that assuredly or confidently about an intervention probably is missing some critical decision-making skills that are essential for treating each individual person based on that person's specific stroke, side of the brain, size of the stroke, family support, all of those other factors. But all of that said, it is something I want to look into more deeply, in that this meta-analysis brought up as something that was salient was that the protocols that were 4 weeks or less than 4 weeks, those outcomes were better. And what's my conclusion of that information, or what do I assume is creating that type of an outcome where the 4 week studies were doing better, is that you just lose motivation, right? How many activities can you do staring at sideways, turning your head sideways, looking into a mirror that's only this, this little window right here? And all of that said, all of that is very important for, as I dove into this rabbit hole, another paper that I found looking at virtual reality. So this next study that I found, which I'm only going to touch on because at some point I'll probably do an entire video on virtual reality, was a study comparing video therapy to mirror therapy. And what they did in this study was they used a video screen, which potentially is much bigger than a mirror, and they videoed the arm actually moving. And the benefit of this is that you can now do movements incorporating the shoulder and the elbow. So you can your toolkit, or your bag of tasks that you can practice with a video, is much bigger, and potentially you can maintain someone's motivation a little bit longer. And yes, in this very, very small study that I think had 33 participants, they did find that video therapy was superior to mirror therapy. But then that led me down a little rabbit hole. And again, I'm just touching on these things. I want this main point of this video to be the mirror therapy and being something that you can start doing today. But given technology, I want to just share these other findings with you so that you can see or be hopeful about like what's probably right beyond the horizon as far as how we can take these mechanisms from mirror therapy and use newer technology to like kind of overcome some of the limitations that I mentioned earlier. And the other study was on total, fully immersive virtual reality, fully immersive VR. That's where you have those goggles on. And this is where I can see you can really tap in to that visual cortex communicating with that sensory cortex and getting this rebalancing in the brain. Remember what I said at the very beginning. We've talked about rebalancing, or most of the interventions that we do now are to take advantage of something that can rebalance the brain, tone down the undamaged side of the brain and turn up the volume on the damaged side of the brain. And total immersive VR to me seems like the most logical next step. Now, the downside of this right now is that these machines are very expensive, and I am quite the cynic, and I think it's not going to be anything that's going to be accessible for most people to do in their homes, which is where it's going to be essential to do, because the first prototypes or the first couple of companies that come out with something, just based on what I know from every other product, Bioness, Walkaid, everything else that's come to exoskeletons that's come to market, is they all claim that, the R&D, the research and development is so expensive that they need to charge these astronomical prices. So then their first order of strategy in getting these things paid for is to go to insurance companies, because they know that they claim they need to charge these huge prices on them, and that it's medically necessary. So then they just go down the rabbit hole of creating the medical necessity for it and getting a billing code for it. So the cynic in me says that it's going to be a long time before this is something that's affordable that everyone can have in their home. But I do think, just like the prices of iPhones have come down, I think the prices of like these immersive virtual reality machines are going to come down to the point where they're going to be cheap enough for people to buy. And then it's just a matter of someone developing a software of bimanual, meaning two-handed activities in these fully immersive VR machines. It might already exist, but that is way beyond my techie kind of brain power. I'm usually about 10 years behind the times when it comes to technology, but you can see where mirror therapy has already proven the effectiveness of using the visual system to rebalance the two hemispheres of the brain. And now the next generation of virtual reality, with something as simple of maybe like a software program that you can put onto some of the devices that are already coming to market, could be the next step or the game changer in improving motor function for those of you that have little to no arm function. So stay hopeful. This stuff is coming down the pike. I just know it. But for right now, hopefully I've convinced you that if you're someone that doesn't buy into mirror therapy, or you aren't doing it, or you think you're not doing anything because you're just using your uninvolved arm, that maybe now by me explaining to you what's going on in the brain, you might be more interested in attempting this. I would say if you are going to do it at home, it needs to be daily, based on that Hebbian plasticity of neurons that wire together, fire together. You're going to have to do this quite a bit. And again, most of the protocols are 5 to 7 days a week. I would say the sweet spot is 15 to 20 minutes a day. And a mirror box is super cheap. I will put a link for one that you can buy on Amazon. As far as therapy tools, it's probably one of the lowest cost therapy tools that you can do. The hard part's going to be actually doing the number of repetitions and spending the required amount of time to get that brain rewiring. But I hope you guys found this video helpful. If you're using mirror therapy and you found it effective, leave your experiences in the comments below. I'm always learning from all of you guys, and I just want to know how many people do it, how many people find it effective. Do you agree with me on some of the limitations, meaning that turning your head and looking in a mirror kind of maybe takes away from the activity a little bit? How, if you have difficulty with attention, how you maintain your attention, all of that. It helps me, it helps the community. So leave your comments below. And then before we leave today, I just want to remind you, if you're someone that you want to take your therapy to the next level, again, I've taken everything that I've learned over the last 22 years and the things that I'm still learning, and I use that to update the toolkit. But we do have a toolkit as part of our membership program. If you want to learn more about our membership program, or sign up, or speak to someone in person where you can talk about the issues that you're having with your therapy routine currently and what some of your goals are moving forward, they can help you decide whether or not one of our programs is right for you. I enjoyed spending time with you all today, and I'll see you in the next video. Have a good day.